Hello, everyone. I'm Ty Huttenhoff, and this evening I'm speaking with Mohammed Faheem, candidate for Congress in Illinois 8th District Democratic Party primary. Good evening, Mr. Faheem. My first question to you this evening is, on your platform, you mentioned that you're very passionate about healthcare reform. Would you mind elaborating on that?
Well, to begin with, Ty, single-payer Medicare is a good start to reforming the current healthcare system. Now, having said that, Medicare itself needs to be reformed. You know, it takes a college degree to figure out the different permutations and combinations of Medicare, A, B, C, D, etc. Dental, hearing, vision, home and community-based long-term care, inpatient and outpatient services, mental health, substance abuse treatment, reproductive and maternity care, prescription drugs, and more should all be combined into one Medicare plan. Why are we going into this A, B, C, D nonsense? Lyndon Johnson, when he signed off on the original Medicare plan, it was just for hospital care. That's fine, I understand that. But as the need grows, we are the only country in the first countries that you call the first world countries that we are known as, do not have a medical system that is geared towards services to everybody. Yep, single payer Medicare is a good start to reforming the current healthcare system.
Great. So what do you say to the people that are going to push back and say, well, that's great in theory, but it's costly. How do you plan on paying for this?
Well, that is an excellent question. This is a theme that is heavily promoted by paid lobbyists of the insurance companies. We are already paying for Medicare for all without realizing it, with a huge chunk of our money going to third parties who do not provide any medical services. Our current healthcare system, Ty, is designed to generate profits for the bean counters.
So go a little bit deeper. What do you mean by that?
Well, let us assume that you are paid $10 an hour, okay? Of which $3 are going towards medical insurance. Now, of those $3, $2 are going to insurance companies for their service, while only $1 goes towards the actual medical cost. Now, if there is a single payer option, the employer pays that $1 directly to the medical provider, with another $1 going to the employee, and the remaining dollar actually stays with the employer. There is no need to raise taxes to pay for Medicare for all. That is where some of these people come in and they are like, oh no, we're going to raise taxes. Yeah, we need to raise taxes. No, we don't need to. All we need to do is to cut out the middleman. Think of it as the Amazon model, okay? If you look at Amazon now, they are delivering things to you without the cost of paying for showrooms, retail locations, exorbitant insurance company profits, services delivered to you at lightning speed. That is how we need to reform the medical system. And again, Medicare for all, we are already paying for it. We just need to make sure that we are cutting out the middleman. Ty, insurance companies, had a $21 billion profit last quarter, not even last year. Yeah, what did they do to deserve that? That is a question that I want to bring out to anybody who's, watching us in this program.
That's great. Well, I want to say thank you for sharing your vision on, having a more equitable healthcare system for the people. Before we sign off this evening, would you like to share any final thoughts?
Well, Ty, thank you for your time to begin with. Folks, again, go register, go out and vote, okay? We need to get these career politicians out of office. They have no interest in writing laws for us. They're going to continue to write laws for the people, the lobbyists that have supported them. And if you look at any of the current congressmen there, I'm not pointing out any fingers over here, and you go and see who are funding these people. They're funded by corporate PACs. They are funded by healthcare, entities. They're funded by attorneys representing healthcare and pharmaceutical industries. Most people don't realize it, but there is a nexus between the pharma industry and the insurance industry. Now, why am I saying that, folks? Look at this. CVS Pharmacy actually owns Aetna Insurance. Now, what interest do you think these people have in lowering drug costs or making sure that, healthcare is available and there is a single payer Medicare option? None. We need to make sure that we step up and we make a change. Thank you very much for your time, Ty.
Thank you. Thank you, Mr. Faheem, for taking the opportunity to speak with us this evening, sharing your insights and your perspectives. You've certainly given us a lot to think about, and we appreciate it. Thank you.
You're welcome.